as the virus spreads to countries everywhere, country-specific border control measures will become less relevant and effective because we are unable to shut Singapore from the world. So we have to now shift our approach. We will still maintain some basic surveillance at the borders, including using swab tests for travelers who come in who are febrile or who have respiratory symptoms, but we will have to double down on the measures we can do within Singapore, and we will look at the whole range of social distancing measures. We have already started social distancing because if you look at measures like isolating patients, putting close contacts on quarantine, issuing stay-home notices, these are social distancing measures which we have already started. Over time, we will have to ramp up and do more social distancing measures. Today, we are announcing something with regard to the suspension of senior activities. Going forward, we will look at the fuller range of social distancing measures we can put in place, including for public events, community activities, school closures, workplace, social distancing, including things like staggered hours, telecommuting, as well as religious services too. So we will cover a broad spectrum and we will see what we should put in place. We are very mindful that these measures can be very disruptive to the lives of Singaporeans. If we were to do all of them at one time, we will literally have to shut down our city and everything will grind to a halt. If you were to start some of them too early, people may become fatigued and then you cannot sustain the measures and then it will not be effective either. So getting the measures right and applying at the right time is critical. And in that context, it is useful to think of these broad suite of social distancing measures as something we can apply from time to time as circuit breakers throughout the entire epidemic cycle. And by doing so, we put in brakes to try and stop the transmission chain or slow down the transmission chain and flatten the epidemic curve. So that should be our thinking around social distancing. And it's something that we are actively studying. We are putting in something today, and there will be more measures that we will continue to consider as over the coming days and weeks. As I said, it is critical to implement the right measures at the right time, and we will do so based on the data, the evidence, and expert advice. Some of these measures will be implemented on a temporary basis, like what we are doing today, or over a discrete period of time. But there will also be measures that we put in place on a permanent basis. They ought to be part of our habits and our new way of life. So one example is the whole SG Clean campaign, and that's why we started with that earlier. That's something we should do not just for this particular outbreak, but in fact we should adopt better hygiene standards at the personal level, at the public level. These are things we should be doing permanently. Right? So we will continue to emphasize some of these things. Permanent measures like washing your hands frequently with soap, improving hygiene standards in all our public places, use of common utensils, common serving utensils rather than double dipping. So these are things which we will continue to emphasize, and we want these to be done on a permanent basis. But for the other measures, not all of them will be permanent. Some will be done on a discrete, or temporary, or over a discrete time period. And as I said, we can apply them at different phases through the epidemic cycle, and we will be looking at what is the appropriate time and appropriate juncture to introduce some of these additional measures.